Hi, my name is Sean Blake. I am an orthopedic surgeon with a fellowship in hand surgery, so I focus on all hand and wrist issues. And I practice at St. Francis Orthopedics here at St. Francis-Emory Healthcare. I fell in love with musculoskeletal anatomy. I actually first started at PT school, doing a lot of dissection, and I was a graduate assistant teaching others in graduate dissection. And that only furthered my passion in medical school. And I just fell in love with being able to fix the anatomy and help people restore function and get out of pain. I've always been interested in the human body just for wellness and prevention. It started when I was 7 years old. There's a picture of myself lifting a barbell over my head and always asking my father questions about fitness. I didn't really know that was in my blood until I started taking an anatomy class in undergraduate, where I just absolutely could not get enough. The function, the biomechanics. And then I thought I'd go to PT school, like I said earlier, to learn the biomechanics, prevent injury, and help people restore their function. But I just wanted to learn more and know more and to be able to help more. So that passion still continues to stay. I love the anatomy, and I love meeting people and giving them hope to get better. I do anything from the everyday hand and wrist situations, such as carpal tunnel, trigger fingers. Carpal tunnel surgery or carpal tunnel syndrome is the #1 compression of a nerve in the upper extremity throughout the world. There's multiple ways to do the surgery, primarily two. One is an open incision, historical, traditional, and then the other is through a camera, which is what I do, smaller incision, less postoperative pain. So the view of everything that I've done in this really continuum is that I felt called. I have a strong faith in Jesus Christ as my Lord and Savior, and I truly believe that He's called me to do all this. I'm not here for my ego. I'm not here for money, for sure. But I believe that God's given me a calling to be a hand surgeon, so I like to connect with folks. I don't just walk in and say, hey, this is what you got, this is what you need to do, I'll see you later. I like to sit down with them. I like to sit below their eye level so they don't feel like I'm over them and overpowering them. And every time I examine somebody, I have to touch their hand. It's the nature of what I do. And that connection is very important. It actually helps healing. Studies show that. But then there's a spiritual component to healing. So if people are okay with me, I will pray with them. I pray with patients in the office, I pray with patients in the operating room, and I pray with patients before surgery to remind them that I am going to do my best to get them the best, and that my hands are God's tools, and to trust in Him, and that may God guide all of us in during the situation to help them get relief. Here at St. Francis, there was an atmosphere that was not seen anywhere else. I've worked at the Cleveland Clinic, I've done private practices up north, but the key of focusing on patient care, but also loving the staff, being a team with the staff, that was evident. And the partners here, I've never found an orthopedic group like this, where they all work together and support each other and truly care about the staff and the patients. So it was just the atmosphere that was really important to me. Well, there's always hope. We may not have exact answers. Sometimes it can be very delineated, and we do have those answers, but sometimes it takes some investigation, repeat examinations. Sometimes we do tests. Sometimes it takes a different test on you that I do with my hands specifically. But there's always hope, and the key is that it's a team between the patient and the physician. I am here to listen to the patient, and that more than half the time can help me key in to where the real issue is. So I do spend more time with the patient. It does tend to make me run behind, but I will listen to the patient, and sometimes it's the last thing they say after speaking for 12, 13 minutes that it clicks for me to think, okay, this is where we need to hone in. So what's most important for the patient is to remember, it's your body. I'm here to help you and help you understand your body as best I can, but I'm here first to listen to you, and that is key in helping you get better.